Hello students, welcome back to my channel. Today again we are here with class 7 Civics. In the last video we have discussed about this chapter, that is role of the government in health, where we came to know that what is health, and also we came to know different aspects of health. Now today we are going to learn about what are the two types of health services in our country. There are mainly two types: public health service and private health services. So our today's topic is about the public health services. So first of all, let us know what is public health service. So as you can see that public health service means it's a chain of health center and hospitals which are run by the government. That means public health service is totally provided by the government support. So, and also it is a chain of health center as well as different hospitals. All they are connected with a chain. Next, another line is there. They are linked together so that they cover both rural as well as urban areas. That means this public service is not only present in rural but also in urban areas. And here all these health center, hospitals and government are supporting one another to make a strong bond that they can provide help to the public. Next, they can also provide treatment to all kinds of problems, from common illness to special service. Common illness means suppose you are suffering from little bit of fever, some kind of small problem if you are suffering, that small problem, to special service. That means any kind of big operation or delivery of any pregnant lady. This kind of special service also provided by the public health services. Now, if you see in this picture, there you can observe that these are the 5 main aspects which are connected with the public service. This is the patient, that means we, public. Which 5 things are connected with it? First of all, primary care. So, if you are ill or suffering from any disease, first of all, the public health service will provide you primary treatment. After that, they will do all the testing in laboratory, that is also connected with it. And after the result, if needed, they will send you to the hospital, that means a big sector where you can get all kind of facilities. After hospital, what kind of medicine, what kind of treatment you need, that you will get from the pharmacy. And then the specialist will treat you accordingly. So all these 5 factors are interconnected. You can see they all are interconnected to one another to give us a best service in a public area. Next is, what are the different types of public service or public sector in health we can see in different areas. First of all, if we visit to the rural areas, there we can see primary health center, PHC. You can see here is one picture of primary health center. So if you are living in rural areas, you can see this kind of public health service, where mainly you can get support for primary illness, not that kind of special services. Because in this sector or in this center, there are small number of health staff as well as small number of doctors. So if any patient admit here with some special kind of disease or special kind of treatment they need, that time the primary health center, sometimes they refer to the district hospital and sometimes they refer to the hospital that are present in the urban areas. So now we come to the district hospital. These are present mainly different district wise, like in North Chobis Pargana, Nodia, in this way. District wise, these district hospitals are present, which is also the part of public health service. And next we can see that in government hospitals are also present. That means the public health service is also present in large cities. For example, Chakda is a small city, but Kolkata is a big city. So Chakda, whatever hospital you can see, that means the government hospital, everyone know that one hospital is present in Chakda. So there you can get all primary kind of treatment. But for your special treatment, you have to visit to Kolkata, like NRS, PG Hospital, Medical College. These all are government hospitals where you can get the special treatment. Now you also know that nowadays due to the coronavirus disease, people are all admitted to mainly Beleghata ID hospital. That is also a government hospitals, and government are paying the treatment for them. And here is one example, that government hospitals in Hyderabad. You can see how much big it is. It is not less than any private hospitals, right? Next, why is this health service called public? Why we are calling it public health services? First of all, one first fact, that is commitment of providing healthcare to all citizens. That means in public health service, each and every people can get the treatment. There is no discrimination, no inequality present. And another vital reason is that you know that our parents pay tax to the government for where we are living. Sometimes for our job we are paying the tax to the government. So this tax government is using for us, not for other people. Means for public, government is using this tax. So this public hospitals are run by the tax which are provided by us. Us means the public. That's why it is a public service. Next, some other reasons are also present that why it is called public health service. Another reason is to provide quality health service. This public service is sometimes free of cost and sometimes very low cost. You can see that in the picture. They are providing this kind of health member or the doctors, especially the junior doctors. They visit many villages or rural areas to provide free of cost treatment to the patient or for their checkup. Even sometimes the doctors provide them free medicine. And also another reason of that why it is called public, to take action to prevent the spread of disease. Many kind of disease which spread very fast. What are those? TB, malaria, jaundice, cholera, diarrhea, chikungunya. These kind of disease also can be prevented by public health service. Next, what are the different characteristics we can see in public health? First of all, population focus rather than the individual. So public health service, first of all, they think about the mass amount of population, not for only individual people, and they take the steps accordingly. Next characteristic, or this can be also, you can write as function of public health. Not only the characteristic, these are also function of public health. Upstream action, emphasizing prevention and the deterministic of health and well-being. So the public health service also think about the well-being of mass amount of people. You know that prevention is better than cure. This line also said by the public health service. As now they are spreading awareness within us that to stop the effect of coronavirus, what we have to do? We have to stay in our home. So this information, this awareness, who are spreading? The public health services. So this way they think about the well-being of the public. Next, they focus on social justice. As I said that without any discrimination, without any inequality, anyone can get the facilities in the public health services. Do you know in the first chapter, Kanta, where she has gone with her daughter to the public health service. That means in public hospitals. Because from a minor people to a very much rich people, everyone can get the facility in public hospitals. Next, it is a partnership with all those who impact on the health and well-being of the population. So, public hospitals not only like to stay within a boundary, they all time like to make partnership with the private hospitals, with the NGOs to make it a broader aspect. That way they can help more amount of people, and also for the betterment of their facility, for the betterment of their infrastructure, they like to make partnership with the other hospitals like private hospitals and NGOs. Next, so today up to this much. Hope you understand that what are the different characteristic function of public health services which we are getting. Your today's questions are: what are the two types of healthcare facilities in India? Just now I have discussed, hope you remember that one. Next, any two function or characteristic of public healthcare facilities, and what is PHC? Answer this question in the comment section. Hope you like the session. Thank you.